Well, it's time for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with a look at Ebola in Sierra Leone. Linord.
Hello, Vincent. Hello, everyone. Sierra Leone has imposed a lockdown in Freetown's Aberdeen district following a spike in Ebola cases. The source of the outbreak is thought to be a fisherman who arrived by boat from another town. The World Health Organization says about 30 cases of Ebola have been confirmed in the area in what is seen as a setback for the country hardest hit by the virus. Health workers have been deployed to carry out house-to-house searches in Aberdeen, and the government is working with its partners to conduct contact tracing programs with aim to contain the outbreak. Dr. David Keretes is the WHO representative in Sierra Leone.
We are able to identify the new infections that are arising in Aberdeen, identify the contacts of those infections, follow them on a regular basis so that if they become sick, we're able to isolate them quickly. That's actually how we end an Ebola outbreak, and that's what's going on in Aberdeen now.
And Aberdeen, located on the tip of the Freetown Peninsula, is under quarantine for up to 21 days, according to the National Ebola Response Center. Now, the World Health Organization recently held a foreign medical teams meeting on the Ebola response in Geneva. The meeting was an opportunity to evaluate the global response and contribution of foreign medical teams in what has been known as the worst Ebola outbreak. The participants discussed the foreign medical teams in phase 2 of the Ebola response, getting to zero, best practices at country level, the future of foreign medical teams, priorities, and next steps.
Prior to this outbreak, there's really only one international organisation on the planet that really has had expertise in the treatment of Ebola, and that's Médecins Sans Frontières, Doctors Without Borders, who've worked in many of the previous outbreaks. So when the call went out for more international teams to respond, the response was rather slow. But I think thanks to the efforts of WHO and certainly the US and UK governments reaching out to our partners, we did in the end mobilize over 40 different organizations to send medical teams.
It's not enough just to be brave. You need to be brave, but you also need to have access to training, and you also need to have access to safe treatment or medical evacuation if you yourself become infected. And so none of that existed prior to this outbreak at scale, and had to be built.
And participants at the meeting also discussed how foreign medical teams can contribute to safe reactivation of the essential health services in Ebola-stricken countries. And that's our Africa Health Report for today. Back to you, Vincent.
Well, Linord, thank you very much. And be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.